Hey, have you ever wondered if your hormones are out of balance? Well, check it out. This is the easiest and most cost-effective way to evaluate if you have a hormone problem. It's called Raglands test. Now, what Raglands test is, it's a way to evaluate if your adrenal glands are telling your body what it's supposed to do. It's also a chronic stress indicator. And what we do is we take your blood pressure lying down. It should be 120/80, and a pulse rate is 60 to 90. And then we have you stand up. It's like a mini stress test. And in perfect physiology, the adrenal glands are supposed to immediately tell the heart to beat harder, otherwise the blood's going to run out of your head. And frequently how people adapt is the heart is tired or weak, or it's not getting a very good signal from the adrenal glands. And so for the body to compensate, what it does is it revs up the heart rate. And so you have this really high end, and sometimes you'll get a diagnosis of POTS syndrome, which basically what it means is the adrenal glands are not telling the heart what's happening. So this is a really neat insight into your health by just doing a standing and lying blood pressure. So check it out. What you do is you have people get a resting heart rate and a resting blood pressure. So just have the patient lying flat. You take their blood pressure. Hers was perfect, 120/80. And then what we have her do is, Macy, just stand up. Now, in a perfect world, what should happen is her blood pressure should go up 6 to 10 beats on the systolic and the diastolic, and the pulse rate should stay the same. And how that works is the adrenal glands are just telling the heart, you gotta beat harder, not necessarily faster. And so this is a really neat way to see how are people managing stress? How are they dealing with it? How is it affected by their physiology? What's happening with their adrenal glands? And the neatest thing about it is it really doesn't cost anything to do it. And there's some really neat things that you can do from a nutritional support perspective. Vitamin B number 4, you can support the adrenal glands. You can use magnesium and protein morphogen therapy to build the heart. And so look at Macy's blood pressure. It went up just like it was supposed to, 131/88. Her pulse rate's changed a little bit, so she's got a little bit of stress, but this gives enormous insight in how your physiology is doing. This is Dr. Jason West and the West Clinic team. We'll see you guys on the next video.